So today I'm going to be talking about Lyme disease. I'm going to be talking about the causes, who's at risk and why, the symptoms, the diagnosis and treatment, prevention, and I'm also going to be talking about my experience with it.
Excellent.
So Lyme disease is one of the most common tick-borne illnesses. It's caused by Borrelia burgdorferi, which is a bacteria found in the GI tract of black-legged ticks, and it's transmitted when the infected ticks feed on any mammal, so it is a zoonotic bacterial disease, and it's normally transferred between like 24 and 48 hours after the initial bite, and there can be a time of weeks to months before the animal is actually symptomatic. And so here I just have an image showing you the sizes of the different ticks. So as you can see, they're fairly small. The adult ones are about the size of a sesame seed, and the nymphs are about the size of the poppy seed. This is important to note because the nymphs are often the ones that are biting canines and infecting them. So ticks like to live in forested areas because it's shady, it's moist, there's tall grasses and shrubs. And there's no breed of animal or type of animal that's more susceptible for Lyme disease. But animals that do have thicker coats or darker coats, it makes it harder to find the ticks on them, which leads to not finding them and the more opportunity the ticks have to infect them. And
So
this,
you can show the play.
Yep. So this is a map that was forecasted the Lyme prevalence for this year by the CAPC, which is the Companion Animal Parasite Council. And I'm from New England, and as you can see, it's very likely. And it's also likely around these areas too. And so my dog, Woodstock, he did have this, and some of his symptoms included fever, recurrent lameness, and they can also have a stiff or abnormal gait, swelling, warmth, or pain in their joints, lethargy, and loss of appetite. The hallmark of Lyme disease is a lameness that shifts between legs. So like 1 week he would have lameness in his front right leg, and then a couple weeks later he'd be fine, and then he'd have it in like his hind legs. And chronic Lyme disease may cause damage to kidneys as well as other organs, so it's really important to get it treated and taken care of. The diagnostic test for Lyme disease is relatively simple. There's the 40x SNAP Plus test, which is quick, easy to tell. So basically you take a blood sample from the animal, and then you would add it to a vial. And then the test has this blue solution, it's a reagent, you just add about 5 drops for like 3 drops of blood. And then you just shake the vial, you put it right here in the circle, and you push down, and then in about 5 to 8 minutes the results will pop up. And so this picture is just showing you what it would look like. So the dot in the top left is just a control one, and then it also tests for like anaplasmosis and heartworm, but the one that we're worried about is the Lyme disease, which is bottom right here. And so this is a positive Lyme test, and this one is a negative. It's important to note that this test just identifies antibodies that are produced in response to bacteria. It will be any antibodies they have. So if they had the vaccine, or if they were already had the disease and maybe was already treated, it will still show up positive. And so this is where the Lyme quantitative C6 antibody test comes in, where you're going to do a blood test and you'll actually have numbers to compare them to like a set value. That way you can see like what level of antibodies they have to determine whether they were infected recently or maybe it was because of a vaccine. As far as treatment goes, you normally just do a general antibiotic such as doxycycline or amoxicillin. In general, the total cost for all like vet bills for the diagnostic test and treatment, it can reach up to $500, but it averages around $200. So this can be expensive and also life-threatening in some cases. So it's important to think about prevention, and the best way to prevent this is to work on tick prevention. So this would be giving your animal a flea and tick prevention like Frontline or any other one that works. This image is just pointing out some of the most common areas that people miss when looking through their animals for ticks. So these are places like under the collar, under their tail, around their groin, between their toes, under the front legs, and in their elbows. So for my dog, we actually found a couple on multiple different occasions, like in between his toes. And he's a black dog, so it was really hard to find them, especially because they are so small. You can also give the Lyme vaccine, and that is contested by some veterinarians, but the ones that I use, we ended up giving him the vaccine later on.
So you're saying it's a little controversial if you vaccinate or not?
Yep.
Is that what you're saying?
Yep, it is a little controversial. And so my experience with Lyme disease, in 2015, I went to Thailand for a veterinary workshop, and so we worked with stray dogs. And so this is Conan. He did not look like this at all when we found him. He had mats everywhere, and he had over 300 ticks on him. So we had to shave him, remove all of the ticks, and then we did a lot of blood tests, and he did come positive for Lyme disease as well as a whole host of other tick-borne illnesses. And this is my dog Woodstock. So we rescued him from Virginia, and he was diagnosed via the 4DX SNAP test, and he was diagnosed positive. And so the first time we gave him doxycycline, and it was prescribed for 1.5 pills twice a day for 30 days. And this is relatively normal. You want to give them for about a month just to make sure that the bacteria is completely gone. However, he did have an allergic reaction to it, so we had to switch to amoxicillin. And so he does fairly well. He only shows symptoms every few years, so he does have it coming back, which is unfortunate, but we have been able to treat it. And because he is an older dog and he does have chronic Lyme disease, it's really important to check the health of his kidneys. And so we do a urine analysis about every year just to make sure everything is in working order. And the things that our vet really looks for is the USG, which is the urine-specific gravity. And the way that we collect his urine is through free catch, but you can also do it through cystocentesis, which is basically just using a syringe and a needle and going directly through the abdomen into the bladder and collecting the sample like that. So his specific gravity was 1.041, which is within the normal range, which means it is functioning fairly well in that he does have normal concentration of urine. And you can also do different tests. So like this, basically what it is a dipstick test. So you would put it into the urine and see what the dipstick test says. And so his bilirubin was around 1, and so was his protein. That's fairly normal. And you want the bilirubin and protein low. So bilirubin is the waste product from the red blood cells that is processed by the liver. So if you did have high levels of it, it would mean that hemolysis or liver damage is occurring. And protein you want low as well, because damaged kidneys could produce a lot of protein in urine because the glomerulus may become leaky, and then that could be how the protein is getting out into the urine. These are my sources.
And that's your sources. Let's give her a round of applause. Questions, comments? It's a great topic. Anybody? I'll let you point.
Yeah.
So you said your dog still comes up as Lyme positive?
Yes.
So is it for any dog that is infected once and they'll have it for life? Like, will it always come up?
Yeah, so if you do the 4DX SNAP test, once they have the disease, once they have the disease, it will always show up as positive on the 4DX SNAP test because it's testing for any presence of antibodies, not just like a high presence. So if they do have any antibodies from fighting the disease, then
Or being vaccinated.
Yep, or being vaccinated, then it will show up positive no matter what. So that's why it's important to do the quantitative C6 antibody test to find the actual numbers for it. Yes.
So one of my friends, his dad got it, right? He ended up with like, it wasn't full-blown Lyme disease, but he ended up with an allergic reaction to meat now, so he can't eat any meat at all for whatever he's allergic to it. Is that a similar thing that happens in animals, or is that just like a people thing?
Repeat the question if you can.
So the question was, you know someone whose father got like partially Lyme disease and they ended up being allergic to wheat for like the rest of their life?
No, meat now,
Meat?
right? You said
Yeah,
meat?
just meat.
Okay, so
Yeah.
that's different. Ethan, you can explain that one.
So,
Listen to this.
so I can't explain necessarily the exact way of how it works in the body, but there is a specific tick in the more southern East Coast, which is the Lone Star tick, which can cause red meat allergy. So it's probably that Lyme disease from the deer tick, or she put the black leg tick. So
Yeah.
different species.
The Lone Star tick, if it bites you, it injects some antigen, some cell markers that are similar to beef. And so the body reacts to it, and then the next time you eat meat, I think it's beef.
Is it just beef?
I think, I want to say it was just beef. Or is it more than?
I was gonna say it's all meat products, because my stepgrandma has this.
Okay, so maybe it's all meat
They-
products.
They can have fish and then.
Okay. But, so you're allergic to it because you got bit by the tick. I mean, isn't this world crazy? Here's another comment over here.
It tends to be allergic to red meat,
Oh, red meat.
and sometimes it goes away.
Okay, yeah. I mean, you know how allergies they can go away. But maybe I would believe the red meat has common cell markers on the outside.
Could be from myoglobin.
No, it's to
No.
alpha-gal, a sugar found in mammalian meats, cow,
Yeah.
sheep, and pigs.
It's gotta be in the membrane, it's gotta be exposed outside, yeah. Okay, other questions, comments? I guess I have one. Does anybody know what this snap test costs? I'm just curious.
Oh, it costs us $50.
Oh, there it is, up in the corner. Thank you, I didn't see that.
My vet hospital pays like $80.
Yeah, yeah, well, I mean, it's approximately, yeah.
That's why
And
it
those
costs a
snap
lot.
tests are amazing. I think the last time I read, there was like getting close to 1 billion made, 1 billion snap tests made because they're so popular. And, you know, some only do one antigen, some do, does antibodies. Fascinating. Okay, look at all we learned today, and we didn't charge you any extra tuition. See you Monday. I might put some more assignments out.
No, it sounds like I have a general idea. I'm gonna be in physics too with you.